Hi, good afternoon. I'm Dr. Sridhar Ganapathy, a pediatrician from Mumbai, and I'm very pleased to tell you today that I'm going to be discussing a pretty serious problem called flu, which we tend to neglect. God could not be found everywhere. That's the main reason why He made mothers to take care of children, and I'm here to create awareness on this issue of flu today. The basic problem here is we find it very difficult to differentiate between the common cold and the flu because they have so much of an overlap. But we should understand that the common cold that we keep talking about, which is caused by viruses like the rhinovirus, is a very mild infection which comes and goes. It does affect all family members. You have a running nose, you have a little bit of lethargy, you are tired, you're not doing well. Whereas the flu could have a spectrum from a mild illness to a severe illness, and they usually present with severe body ache, extreme tiredness. You can have very high fever, you could have a cough, you could have a sneeze, you could have a running nose. So it's so very essential for us to differentiate the two. How does flu spread? To spread any respiratory infections, the droplets are the most important source. Don't we talk? We sneeze, we cough, and that's the way we spread droplets. And it's very easy to pick up an infection through droplets. Then we have the so-called the hands touching all over the place. We have the mobile phones, the TV remotes, the switch, the door handles, all which are so badly infected. I'm proud to be an Indian. We take care of almost about 16.2% of the world's population, and we have a very congested society, a congested school. Everything seems to be congested. Let's take a classroom scene. You have a classroom where you should be accommodating about 20 individuals, and there are about 50 trying to fit into that small classroom. You have a bench which is pretty small, and you tell the students not to write too fast, probably because they would be writing in the other person's book. So congestion is a problem. So spread of an infection in a classroom is pretty common. And let's take this scenario where you have a few children with a running nose. And then one of them gets admitted to the hospital for a respiratory complication and then ends up on a ventilator and is diagnosed to have influenza. And then you have the media covering influenza and talking about all the bad effects of influenza and how you could prevent it and the complications. So the panic button is on. What do we do next? The teacher is pregnant, she's apprehensive. What's going to happen to her and her little baby? The students are apprehensive. They don't know whether they should get vaccinated now. There are some children who are very happy because they have been vaccinated and they are sure about their protection. So this is a scenario in a classroom which is pretty common nowadays, especially when we make a diagnosis of flu in one individual who gets admitted to the hospital with a respiratory complication. Now, what are the limitations of this problem? The child gets admitted to the hospital. Do we have a good antiviral which can take care of that infection? Yes, we have some antivirals, but they have to be given within the first 48 hours for efficacy. More the time has lapsed, less the efficacy of these drugs. These drugs also come with a big packet of adverse reactions. You have GI intolerance, you have even suicidal tendencies linked to some of them. So drugs are a problem. And it's rightly said that when you are given a drug for an infection, you need to recover from two things, not just the infection, but also from the adverse reactions or the effects of the drugs. So there is this therapeutic limitation. Then comes the diagnostic limitation. We do have rapid diagnostic tests of variable sensitivity and specificity. So again, in a resource-constrained community like ours, diagnosis again becomes a problem. So we have diagnostic limitations, we have therapeutic limitations. So what are we left with? Only preventive measures. And they are pretty good preventive measures. So in prevention, I would like to talk about immunization or vaccination. One of the most effective methods of healthcare. An investment that gives you the best of returns. Influenza is a potentially preventable disease, which can give rise to death, which can cause economic losses, and you have vaccines that have got very good efficacy, which can curtail the complications and prevent death. So I think immunization is here to stay, and we should be investing more on immunization rather than other strategies. Now let me give you an example which should make you aware that immunization is here to stay. We do come across people who tell us that we have had so many attacks of influenza, doc, it comes and goes. It's not so. When I buy a car, don't I get the insurance with it? Don't I use the seat belt even though I'm good at driving? It's because you're not sure about how the others drive. Same thing with vaccination. Same thing with infections. You don't know when an epidemic can hit your city. So it's very essential that we need to get vaccinated. So how do we go about this vaccination? Below 6 months, we are extremely susceptible. So pregnancy, yes, the right time to vaccinate. A pregnant female is also very, very susceptible to this infection, and mortality rates are pretty high in pregnancy because it's a low immune state. So vaccinating in pregnancy would go a long way in giving a significant antibody titer in the newborn babies. The cocoon strategy. What is a cocoon strategy? You vaccinate all the members of the family who are going to be taking care of this little one in the first 6 months. So when you have a high level of immunity in the household, you need not wear a t-shirt which says no hugs and kisses. Let's say we're above 6 months of age. Above 6 months of age, you have wonderful vaccines. You need to talk to your family physician or your pediatrician on the availability of vaccines and what vaccines to take and the schedule to be taken. And these vaccines are not efficacious, they also prevent complications. Safety, these vaccines are extremely safe. Compliance has never been an issue. They have the same mild adverse reactions, a little bit of pain, you may get a little bit of fever, but they have not been related to any major side effects. So it's always prevention is much better than treatment, especially in this condition where you have therapeutic and diagnostic limitations. So what are we bothered about? Are we bothered about the cost of vaccination? No, not at all. The cost of not vaccinating is more dangerous than the cost of vaccinating. You end up in the hospital, you end up with complications, you have ear infections that can give rise to deafness, you have pneumonias that can give rise to a long hospital stay and a lot of economic loss, could even lead to mortality. So summarizing, I feel, at least in my practice, flu is a disease with an unpredictable course, and we see it throughout the year, which has severe economic and health consequences. For me, vaccination is the best investment with the best returns. Thank you.